You know that feeling, right? Leaving the doctor's office, maybe after a treatment, and you just feel relief. Like, okay, check that off the list. Problem solved.
Ah, yeah. That sense of closure.
Exactly. But what if that feeling, that closure, is actually, well, a bit misleading? What if the really crucial part, the thing that really makes the difference for your health, happens after you leave?
That's precisely it. It's this often overlooked step we're really digging into today. We're not just talking about the initial visit or the treatment itself.
Yeah.
This whole deep dive is focused squarely on follow-up appointments. Their role is surprisingly huge in your whole healthcare picture.
Right. We want to get past seeing them as just, routine check-ins. They're
Yeah.
often much, much more critical than they seem.
Mm-hmm.
And for you listening, maybe you're someone who likes to get the facts, get informed quickly, but without getting swamped in like medical speak.
Yeah, keep it clear.
That's the goal. We've looked at some really interesting sources. We've got insights from Joint Commission International, that's JCI, a big name globally in healthcare quality.
Okay.
And the National Accreditation Board for Hospitals and Healthcare Providers, NAPH, they set key benchmarks here. Plus, expertise from healthcare consultants, Supremedic, and some really practical advice on follow-up best practices generally.
So quite a range of perspectives.
Definitely. And our mission really is to pull out the core message from all this. Why are follow-ups so vital? What are the real, often underestimated risks if you skip them?
And importantly, what practical things can you actually do to make sure they happen? Give you some real strategies.
Okay, perfect. Let's jump right in then. Why do these follow-up appointments matter so much? What's the fundamental purpose here?
Well, at the most basic level, think of them as essential progress checks. They're the main way to see if a treatment is actually doing what it's supposed to do. Are things moving in the right direction?
Okay, monitoring progress makes sense.
And crucially, they allow doctors to spot complications early, problems that might be, just starting under the surface before they become serious.
So early detection.
Exactly. Plus, they're key for preventing a relapse, especially with ongoing conditions. And maybe one of the biggest things, they allow for adjustments, tweaking medications, changing the treatment plan based on how your body's responding over time.
Right. So it's not like a one-and-done fix. It's more like constantly fine-tuning, like calibrating something complex.
That's a great analogy, actually. You need those regular checks to keep things running optimally.
Yeah.
And Supremedic's Lifelines podcast really hit this point home, saying follow-ups aren't secondary at all. They're just as important as the first visit. They can literally be the difference between, well, getting better smoothly and hitting a major setback.
Wow. Okay. And when we think about these big organizations like JCI,
Yeah.
you mentioned their focus on zero harm and highly reliable care. How do follow-ups fit into that bigger picture?
Well, it's a direct link, really. Reliable care isn't just about the surgery or the initial prescription. It's the whole patient experience, end to end. Follow-up appointments are fundamental to that. They ensure care is consistent. They act as a safety net to catch issues before they cause harm. It's like a feedback loop,
A feedback loop. How so?
The information gathered in follow-ups helps the whole system learn. It helps refine protocols, improve training. It all contributes to making care safer and more reliable, closer to that zero harm goal.
Got it. So it benefits the individual, but also improves the system overall.
Yeah.
Okay, let's flip the coin. What happens if someone skips them? They feel okay, maybe they're busy. What are the actual dangers?
Yeah, this is where it gets potentially quite serious. The downsides of missing these appointments can be, well, bigger than people often realize.
Okay, like what? Let's start with complications. If you feel fine, isn't it logical to think you are fine?
It feels logical, but unfortunately, it's often not the case. As Supremedic's podcast pointed out, lots of conditions, especially right after surgery or treatment, don't show obvious symptoms immediately. The Lifelines article really highlighted this for post-surgery. You might feel okay on the surface, but maybe an infection is brewing internally, or a wound isn't healing right.
Or worse.
Or even things like silent blood clots. Really serious stuff. The follow-up is that dedicated time for a professional to actively look for those subtle signs before they blow up.
That's quite sobering. Okay, what about medications? If you're prescribed something and it seems to be working fine, do you really need to keep checking in about it?
Very often, yes, absolutely, because how well a medication works can change. Your body changes, the condition might change. Adjustments are often needed to keep it working optimally.
Oh, okay.
Both Supremedic's podcast and the Lifelines article stress this. Think about chronic things, diabetes, high blood pressure.
Right.
Your dosage needs might fluctuate based on diet, stress, activity, just the natural course of the illness. Follow-ups are where that monitoring happens, where those vital tweaks can be made. Lifeline specifically called out diabetes, BP, thyroid conditions as needing that regular adjustment.
So the prescription you walk out with initially isn't necessarily the final word. It needs managing.
Exactly. It's dynamic.
So what if those adjustments don't get made? If the condition isn't monitored closely because follow-ups are missed, where are the long-term risks?
Well, the risk is that the underlying condition just gradually gets worse, sometimes without you really noticing until it's much more serious. Supreme Medic's podcast warned about this with things like heart disease, certain cancers, ongoing infections. They can progress fast if not watched closely.
And the Lifelines article.
It gave some pretty stark examples. Poorly managed chronic conditions like diabetes, hypertension, thyroid issues, they can eventually lead to major events. We're talking strokes, heart attacks, kidney damage.
Wow. Serious consequences.
Definitely. And they also brought up elderly patients' conditions like Parkinson's, arthritis, dementia, need regular checks to catch subtle declines early. Even seemingly simple injuries, like a fracture that feels healed, might need follow-up to prevent chronic pain later.
And, something that really struck me from the Lifelines piece was the impact on kids, missing those follow-ups for vaccinations or growth checks.
Oh, absolutely crucial. Those checks can catch developmental delays or other issues early when intervention makes the biggest difference. Missing them can have real long-term consequences for a child's health and well-being.
Right. Okay. And one more risk factor, the cost. It seems counterintuitive, maybe, but skipping an appointment to save money, does that actually work out?
Almost never in the long run. That's a false economy.
Yeah, my gut feeling too.
Both Supreme Medic's podcast and the Lifelines article made this point clearly. Skipping preventative follow-up care often leads to problems getting worse, needing much more intensive, and yes, much more expensive treatment later on.
Like emergency visits or hospital stays.
Exactly. Lifelines specifically said avoiding follow-ups because of cost concerns can ironically lead to way bigger medical bills down the road.
Okay, message received. Loud and clear. Follow-ups are critical. So let's switch gears to solutions. What can we do practically to make sure we actually go?
Right, the proactive stuff. And the sources had some really good actionable tips. The first one sounds simple, but it's maybe the most effective.
Go on.
Schedule your next follow-up before you even leave the current appointment. Just get it in the book right then and there.
Strike while the iron's hot.
Precisely. Both Supreme Medic's podcast and Lifelines emphasize doing it immediately. Don't leave without that next step locked in.
Good advice. What else? How do we remember it weeks or months later?
Reminders are key. Use whatever works for you. Put it in your phone calendar with alerts. Write it on a physical planner. Stick a note on the fridge. Ask a family member maybe.
Sure.
And check if the clinic offers automated reminders. Texts, emails, Supreme Medic, and Lifelines both suggested taking advantage of those if they're available. They really help.
Yeah, those automated nudges are great. Okay, what about when you're actually at the follow-up? How can you make the most of it?
Be an active participant. Don't just sit there passively. Ask questions.
Like what kind of questions?
Ask about your progress. How am I really doing? Make sure you understand the treatment plan moving forward. And definitely bring up any new symptoms or concerns you've noticed, no matter how small they seem.
Okay.
The Lifelines article had great examples like, do I still need this medicine? Or what happens if I miss a dose? Even asking about alternatives. Is there a cheaper or easier option?
It's about engaging in a dialogue, isn't it? Not just receiving instructions.
Absolutely. It's a partnership.
And what should we bring? Any specific info?
Yes. Keep your doctor in the loop. Bring any new test results you might have gotten elsewhere. Have a list of all your current medications, including dosages. And mention any new health issues or significant changes since your last visit.
Basically, give them the full, updated picture.
Exactly. Lifelines stress having that complete info, lab reports, scans, med list, even old prescriptions can be helpful sometimes.
Got it. Now, sometimes these conversations can get complex, maybe a bit overwhelming. Is it ever a good idea to bring someone with you?
Definitely. A support person can be invaluable, especially if the discussion is complex or if you just feel better having a second pair of ears.
Yeah.
Both Supreme Medic and Lifelines suggested bringing a family member or a trusted friend. Particularly helpful, they noted, when accompanying elderly parents or taking young children, someone else can help catch details or ask questions.
That makes a lot of sense. What about honesty? What if you haven't quite followed the doctor's advice perfectly, maybe missed some medication doses?
Be honest. It's so important. The Lifelines article made a specific point about this. Tell your doctor if you've missed doses.
Really? Why?
Because they need to know your actual experience to make the right decisions. If they think you're taking the full dose but you're not and the condition isn't improving, they might wrongly increase the dose or change the medication. Honesty leads to better care.
Okay, transparency is key. What if just getting to the clinic is a real challenge? Transport, time off work.
That's a valid barrier for many people. Lifeline suggested exploring teleconsultations.
Online appointments.
Yeah, if it's suitable for your condition, obviously. For stable conditions needing monitoring, but maybe not a physical exam, an online follow-up can be a really convenient, effective alternative. Worth asking about.
Good option to keep in mind. And I love this practical tip from Lifelines, asking for a follow-up summary before you leave.
Oh, yeah, that's brilliant. Just ask the doctor or nurse to quickly jot down the main points.
Like what?
Key next steps, any warning signs you need to watch out for, things that mean you should call them immediately, and confirmation of when your next appointment is, or, the conditions for needing one. It just nails everything down.
Super helpful. Okay, so despite all the best planning, life happens. What if you do miss a scheduled follow-up? What's the immediate next step?
Don't panic, but act fast. Supermedic's podcast was really clear on this. Call the clinic or doctor's office as soon as you realize you missed it.
Don't just let it slide.
No, definitely not. Reach out right away to reschedule.
And when you call.
Just explain you missed the appointment, briefly why, if you want, and ask what they advise. How should you proceed? They'll guide you.
Okay.
And critically, as both Supremedic and Lifelines pointed out, if you notice your symptoms getting worse after missing an appointment, be extra vigilant. Call back and try to get rescheduled even sooner. Don't wait for things to get really bad.
Right. Be proactive about rescheduling, especially if you feel things changing. This all really highlights how important follow-ups are for us as individuals. But how does this connect back to the bigger picture? You mentioned JCI and NABH earlier. The quality organizations?
Yeah, it connects directly because good follow-up care is quality care. JCI positions itself as a global leader for healthcare quality and patient safety.
Okay.
And NABH, part of India's Quality Council, is there to set up accreditation programs and basically set benchmarks for progress in healthcare.
And Supremedic works with organizations on getting that NABH accreditation, right? So they're involved in upholding these standards.
Exactly. So consistent, thorough follow-up isn't just a nice to have. It's a practical application of the principles these organizations champion.
How so?
Well, when clinics and hospitals have good systems for managing follow-ups, they're actively contributing to better quality and safety. It means better monitoring, earlier detection of problems, timely treatment changes.
It all fits together.
Precisely. It aligns perfectly with the standards and best practices pushed by JCI and NABH. It's embedding that culture of continuous, proactive patient management.
Okay. So as we wrap up this deep dive, let's boil it down. What are the absolute must-remember takeaways for everyone listening?
The number one message has to be, follow-up appointments aren't optional extras. They are a fundamental, non-negotiable part of good healthcare.
Not just hoops to jump through.
Not at all. They're essential for tracking your health, catching problems early before they escalate, stopping conditions from getting worse, and honestly, avoiding bigger, more expensive health crises later.
And the practical stuff.
Remember the dose. Schedule the next one before you leave. Set reminders, lots of them. Be active in the appointment. Ask questions. Keep your info updated. Bring support if you need it. Be honest with your doctor.
Got it. And I keep thinking about that point from Lifeline's recovery being a checkpoint, not the finish line. It really resonates, doesn't it? It's like in anything else important.
Exactly. Think about projects, relationships.
Yeah.
If you don't follow through, if you drop the communication, things fall apart, right? Opportunities get missed.
Yeah, engagement drops off.
It's the same, maybe even more critical with your health. Staying engaged through follow-ups ensures that journey towards well-being actually continues effectively. It keeps the momentum going.
So maybe a final thought for everyone listening is just to take a second, think. Are there any follow-ups you've perhaps let slip or maybe need to get on the books?
It's an ongoing process.
Your health journey needs those check-ins, those guideposts along the way. Don't underestimate them.